Hello, and welcome to the Frontline to Finish Line podcast, your go-to sport and exercise medicine podcast series. I'm Claire Spear, a specialist MSK physiotherapist and Pilates instructor with an interest in aquatic physiotherapy. And I'll be joined by my co-host, Dr. Ralph Mitchell, a GP with a specialist interest in sport and exercise medicine, who has vast experience across both elite sport and the NHS. Together, across this series, we'll be speaking to a number of industry-leading experts, exploring some fascinating topics across the multidisciplinary world of sport and exercise medicine. We're delighted to have you join us, and we hope you enjoy the listen. Welcome to today's Frontline to Finish Line podcast of the Faculty of Sport and Exercise Medicine. I'm delighted today to be joined by Sarah Wratten. Sarah is a chartered physiotherapist. She's been working for 28 years plus some maybe, and majority of that time has been working in aquatic therapy. So she's spent a lot of time in her career in water, and she's joining us today to talk about all things aquatic therapy. Sarah's career, she's spent time in the NHS, the private sector, working for the Ministry of Defence. She's the current chair of the Aquatic Therapy Association of Chartered Physiotherapists, which we'll call the ATACP for short, because it's just much easier. And she also teaches internationally, both foundation level aquatic therapy for physiotherapists and healthcare professionals, as well as higher level musculoskeletal. So we're delighted. Thank you so much for joining us, Sarah.
Oh, thank you for inviting me, Claire. Well, I think it's thank you. I'll let you know afterwards.
First things first, for me, we've known each other quite a while now. You were one of the people that taught me how to work in the pool. But I don't think we've ever spoken about what was the draw for you into aquatic therapy. What got you into the water in the first place?
First place was second year undergraduate, because I had a placement with a very experienced aquatic therapist who just inspired me. And then I realised from very early on how the benefits of aquatic physiotherapy will help patients. And so it's something that I've pursued my whole career, both in this country and abroad.
You most recently were in Ukraine, is that right? Or have you been somewhere?
I have taught out there, yes. I've taught in a few places I've been fortunate to do, and courses I've taken have been in America and Valence, Switzerland as well. So yes, it's nice to be able to travel and see different hydro pools.
Yeah, and work with that international community as well. As physiotherapists, we don't always get that opportunity. I think aquatic therapy is particularly good at trying to bring the international community together.
Yes, there's a lot of passionate organisations out there that obviously they're coming together, and it's nice to see that we're all working with the one goal in mind, to help improve patient care and rehab, which is good.
So for people that aren't familiar with aquatic therapy, I suppose the first question is, what is it? I think people realise it's involving water, but tell us a little bit more about.
Well, it's using, if you're a physiotherapist, you're providing aquatic physiotherapist. If you're not a physiotherapist, but working maybe under the supervision or as an assistant within the pool, then you might be providing aquatic therapy. And it's basically clinical use, clinical treatment in a warm water pool. So a hydrotherapy pool is anything that's probably above 32 degrees, because that's when you get the physiological responses. And up to about 35.5 before you start to think that you're in a hot tub instead. But yes, it's basically adapting your physiotherapy practice to utilise the properties of water with the physiological benefits and psychological benefits as well. So it's just a different environment, but and a set of skills that we can use to help promote rehab.
And talking about those physiological effects, once we get kind of that past that 32 degrees, do you want to tell the audience
how that works? Yeah, because we're lucky, because in the hydrotherapy pool we've got more advantages than we have maybe on land. Because yes, we've got the benefits of exercise, the physical benefits you do, but being in water has its own unique benefits from the physiology point of view. We know that in water you've got hydrostatic pressure, and that hydrostatic pressure increases with depth, which creates a pressure gradient. And what that does, it shifts blood volume about 700 mils, which is nearly a bottle of wine. But it's a significant amount. It shifts it from your lower limbs up around your heart and lungs. And then what that does, it increases your heart size by about 30%. So you've got a massive increase in volume, stretching the receptors within the heart, within the atria, and sends a message to the brain to say, whoa, get rid of fluid. And then all the systems are put in place to cope with that, what that false sense of overloading is. Because of that, it's really clever, because there's the difference between the cold water and warm water then, because if it's 32 degrees and above, you'll get peripheral vasodilation, so the widening of the peripheral blood vessels to help dissipate heat, promote sweating. And because of that, you actually, even though you've got this increased stroke volume, you increased cardiac output to cope with the extra volume, you don't increase your blood pressure because of this less resistance in the periphery, which is fantastic, because that means you can optimally transport blood around your body, improving oxygen delivery, improving removal of waste products, your metabolic products, which is always great in our athletic population or sports rehab. And you can get better circulation for anyone that's got any kind of ischemic type pain. So I think that fundamentally with the heart stuff is a huge region. It's every athlete's dream, isn't it, to have an improved cardiac output with actually potentially slightly lower heart rate and definitely an 8-9% drop in blood pressure.
Absolutely, yeah. Being able to utilise that then to challenge the system and get them exercising and improving the cardiovascular system.
Well, this is it, huge, because obviously it's not just the heart, then there's the lung rehab as well, because you've got far more pressure against your lungs in the water than you do out the water, which means then your increased work of breathing is significant. In fact, the airways resistance is up at 58%, so nearly 60% increased work, because not only just the pressure, your chest circumference is about 10% less in water, but you also got the blood engorgement, reducing some of the airway space, and you've got that shift of your diaphragm because of buoyancy, the hydrostatic pressure creating an upthrust. Therefore, your abdominal contents and diaphragm have actually pushed freely, so that it's an increased work of breathing that. And some people used to think, be careful with people putting them in that are short of breath. But research, whether you're the athletic population or someone that's muscular dystrophy or spinal cord, you could improve your respiratory function. And as we know with our sports rehab, it's really important to try and increase the endurance of respiratory muscles, because if they are out doing whatever sport it is and they start to fatigue in the respiratory muscles, then you're going to redirect blood flow from the performance muscles. And there's been lovely research out there to show the benefit of respiratory training, especially in respiratory muscles. Doing that in the water shows good results for improving performance in whatever sport. Yeah.
Well, look, that makes you think for the athletic population, certainly just as part of the normal training, they can utilise that. But certainly for people that are injured and maybe not able to get that same level of cardiovascular challenge because they've got an immobilised limb, they're in pain, that's limiting what they can do. There must be people listening thinking, oh my goodness, we really utilise that to keep people fit and well during their injury. And that's not considering the benefits of them rehabilitating that particular injury in the water as well.
I completely agree with you, Claire, because, we're seeing it more now, especially with places like St George's Park and most of the football clubs having aquatic facilities, because you've got your post-recovery, but also you've got the injured player with the psychological benefits of still being able to train with his teammates. So putting people in to do their cardiovascular training, keeping their conditioning going regardless of injury, because you can offload it, because we've got the buoyancy that offloads body weight. It's a huge benefits. And then you mentioned pain, because obviously going back to our physiological benefits, pain management is huge in water, because not only that improves circulation, will get rid of any kind of waste product that causes a type of pain, like an ischemic type pain, but you also got your pain gate theory with the sensory feedback from pressure, touch, water movement, temperature. then you've also got that autonomic response that you get, because it's a well-known fact that when you get in a nice warm water, you go, oh, this feels wonderful. And it's not just because it feels wonderful, because, it's also because we suppress the release of noradrenaline when you're immersed. So if you've not got noradrenaline flying around, that's one of your sympathetic nervous system transmitters. You're calmed down that kind of pain, that sympathetic drive pain that can persist pain. So yes, an environment where you've got less pain, less loading because of the offloading from buoyancy, better circulation, better heart and lung function. I mean, you've got a head start, haven't you, on any kind of rehab?
Absolutely. Is thinking about those physiological changes and effects, are there people that you would say absolutely don't get into the pool? So for any kind of clinicians listening to this and thinking, oh, I'd love to get everyone in there, are there people that you'd say it's not really suitable for?
There's really only a handful of people that are contraindicated nowadays, much less than what they used to be. Because yes, previously, like I said to you, it was, anyone short of breath, don't put them in the pool, but you can modify it. Don't put them in as deep, don't submerge, because obviously research that I've talked about so far is up to your neck. So you don't put anyone as deep. And it was, it's Bruce Becker, Professor Bruce Becker, that's really advocated and pushing aquatic therapy for respiratory and cardiac function. So in terms of who don't you put in, it's very unlikely to be your sporting population. It's going to be someone who's got acute cardiac or respiratory failure that hasn't got a medical management in place. So it tends to be your inpatient kind of scenario that'll be an issue. Anybody that's been discharged, able to attend a pool as an outpatient, is very unlikely to be at that point where they're too unstable to get in the water. There's obviously things like DMV, diarrhea and vomiting, and raised temperatures from an infection risk, but certainly not from a cardiovascular or physiological response.
Yeah, brilliant. And then thinking about how you use the water, the properties of the water for rehabilitating any kind of musculoskeletal condition, because I know you work with all range of people.
Yes. And the key thing is understand the properties. And I think this is where I think it would be great for people to have a better understanding of the properties of water, because unfortunately, land-based exercise put in the pool won't always work. In fact, more than likely it won't be appropriate, because people are not understanding the unique difference between air and water. So, oh gosh, no, I'll go off on a tangent if I start talking about all the unusual, less effective research that's gone on out there. I might reference a couple, but maybe not. Fundamentally, difference between water and air is hydrostatic pressure, which we know is good for edema management, and that creates pressure as you go with depth. So you can manipulate depth to help you with your rehab, depending how much pressure you want. We've got then buoyancy, which is basically our up thrust, but it also offloads the body weight. And we know from research where on the body we're getting a rough weight relief or weight bearing. So around your ASIS waistline, that's your 50% weight bearing or weight relief. Up at your chest level, T11, stiffy sternum, 25-30% weight bearing, 75% weight relief. I only say the both because research quotes weight relief, whereas as a physio, my head goes, clinical goes, how much weight bearing. And then up at the neck, about 10%. So if you've got a really good hydrotherapy pool, that will give you variable depth. And certainly all the modern pools, and hopefully within the sports environment, they'll have part movable floors. You can be really specific with your loading. And it's really important, actually, because there's been some great research that looks at muscle activity in the lower limb. Wow. So if you want to work on someone's gait re-education, getting them back to loading, different depths will give you different muscle activity. They just looked at proximal quads, hamstrings versus distal tibant gastroc activity. And when we look at the EMJ activity out the water, it's a bias to your proximal muscles versus distal. And that's the same in the pool until you get about 50% weight bearing lying around the waist. And as it goes deeper then, because your body's not governed by gravity, it's starting to be controlled by the buoyancy of the water, which is constantly moving, and it's offloaded you so much. Actually, you'll get more distal activity. So great if you're trying to activate people for a lower leg injury, get them better. But if you're trying to normalize someone's walking pattern and get them back to using good quads, hams, glutes, then you're going to really want to work starting to get them shallower. So that's buoyancy, what I covered so far. Hydrostatic pressure, buoyancy. So I've got a couple of other tools in the bag. That's obviously the differences are resistance in water. So water has a huge amount more resistance than air. You fall 14 times slower in water because of it. So you've got loads of times to, in a safe environment, to work on reactive forces, all your balance, all your ligament injuries. There's great research out there showing you can get people back much less pain and faster stability indexes. But the resistance also is great for strengthening. And so we use this drag resistance as a medium to really start to challenge people's endurance strength. So that's that one. And the only thing I would say is when people ask me about strengthening in water, and there's research out there that backs this all up, but if people say to me, can you achieve a grade 5 muscle power in the pool? Can I rehab people only in the pool? And I will always say, not only, it's a part of rehab.
Yeah.
Because remember that offloading of the body weight. If you then want to try and mimic, say, a leg press, but 1.5 times your body weight for, say, pre-running drills, trying to mimic leg press in the water would be the equivalent of having a float and trying to push down against it, having the float under the foot. Which, if you had to mimic 1.5 times your body weight, then that size of float to mimic that for a 1 rep exercise would shoot you up to the moon, sort of thing. So it doesn't really work. And we use buoyancy resistance as well as drag resistance. But again, if you're using buoyancy, you've got to be careful what direction you're acting in, because otherwise you'll make the mistake. That's the classic with the research on squat strengthening.
Yeah.
You see that one, because that one, Claire, is where they did a strengthening program to compare aquatic versus land treatment. And they decided the best strengthening for the, quads was a squat program. So they did a 6 to 8 week program on land of squats, and they decided to do 6 to 8 week squats in the water, and concluded that you could get better strengthening on land than you can in water, which to me, that does highlight a lack of understanding of the properties of water, because obviously buoyancy is assisting the squat movement. Versus resisting, and the body weight's completely offloaded. So it's this kind of misunderstanding is where I think aquatic therapy sometimes gets that misnomer of being too easy.
I think we both know you can work people as hard as you need to. It's very, very normal feedback from clients that they've done a session, they felt like the session was fairly easy, certainly first time in the pool, I think, this is okay, half an hour, and I feel like I've not done very much. And then you see them or hear from them, and they say, gosh, the next day I could really feel the muscles working. I really got the DOMS. So it's not always that way, but we do often get that feedback.
Well, I think Sophie Hayward from Australia has done some wonderful research in looking at forces, and especially with osteoarthritis or functional exercise. So one of the studies looked at the fact that in water, we always self-select slower movement because of that drag resistance I mentioned, which is great. But if you go too slow, it's not going to challenge you. And all the research that tells us that you can work someone equally as hard on land as you can in the water states if it's the equal intensity and frequency. So if you take a self-selected slower pace in the water, it's not going to push someone at the intensity they need. And certainly when we're using drag resistance, you're going to need to go faster. And we use speed, metronomes to try and keep a pace to push, and you've got to work with loads of speed, and we work with surface area as well. So trying to increase surface area using the use of fins is great, or hydrotone boat. It was Bohannon, and I apologise if I haven't pronounced that right, because I'm terrible at pronouncing things. But they compared land quadriceps activity, vastus medialis and lateralis, and looked at hamstrings as well, for a simple knee flexion extension exercise against force. And they found that it's much greater force can be produced out of the water, but in the water, a barefoot, compared to barefoot would be definitely easier. But as soon as you use a hydrotone boot, a boot that creates a lot more surface area, like a fin, then you can equal the forces out. So people that tell me that they can't strengthen effectively, I think possibly not using either the drag with the speed and the surface area or the buoyancy resistance effectively.
Yeah.
But it is more endurance strength, really, I think.
Yeah, than pure creating power in the same way.
We haven't mentioned a metacentric effect. That's always the one that throws people as well. But if we're going to cover the hat trick of tools in the water, I suppose we should throw that one out there.
Go for it. Explain that on verbally. So
I know very well that you know what that is, Claire, but
I do. People listening won't.
No, it's a naval shipbuilding term. Not that I'm into any kind of naval shipbuilding engineering, but I am into the fact that I use this rotational effect. So because we're working in water, you've got a center of gravity that will still act on the body because there'll still be a density to it, a weight to the body. And then you've got this center of buoyancy now because you've got the force of buoyancy. And where these 2 points act on an object will determine how stable or unstable, how much equilibrium they have. So if they're vertically in alignment, then you'll be nice and stable. However, if that changes, say you take an arm out, you move a limb or something, you're going to move the center of gravity in relation to that center of buoyancy. And what it will do is create this rotation effect. And I think the best way of thinking about that is if you're in a little boat or a kayak or something, if you're nice and low in the water, i.e. sitting or even lying, then you're keeping those center of gravity and buoyancy quite close to each other, and you should be fairly stable. But if you stand up, and certainly if you stand up and try and wave to someone, then you're going to move that center of gravity up and over to one side, which will make you very unstable, and you're wrong. And if you've ever played with, or here's a debate, noodles or boggles, what are they? Long tubey floats in the water. If anyone's ever been in the pool and tried sitting on one of those and then takes their arm out, they'll feel that metacentric effect. And we can use that really well for stability in patients. Well, stability is not the right word anymore, but for trunk and pelvic control work. And the water's so sensitive to change that it's a really good environment for people to actually feel how well they control their body position.
And as well, I think being in the water, certainly for those, if we take it away from maybe the athlete population, but for those people that are becoming a little bit maybe more fearful, so thinking about the older population that maybe have had falls or, maybe aren't exercising as much as they used to because they're worried about being outside in open spaces. It's so nice to get those people into the water and then suddenly have this freedom because they know that if they lose their footing, they're safe, they're going to be caught, and they have a little bit of reassurance that they can move more freely, and you can see a huge change in the way that they walk in and then
I think you've just summed it up, but and I think it's for everyone. It's giving people a safety net, and what it does, it allows them to push themselves a little bit further out of their comfort zone, should we say, their base of support. So therefore they do challenge, and it's exactly what, even after the ankle or knee ligament reconstructions, the ACLs, they found that they can improve their static and dynamic balance quicker in water. Yeah. Because people do say to me, why the pool? To like someone young and fit, why would I bother getting in the pool? You sort of thing. Yeah. And I say, look, I'm not going to say I'm going to make you better than what I could rehab you on land, but I'm going to probably do it faster. Yeah. Because I can get you doing things a lot quicker and in a lot safer environments. So you should get your movement back faster. You should get your balance back faster. You hopefully get your muscle activity and reduce your pain and your swelling so much quicker by getting in the pool in that early rehab stage.
Absolutely. For those people that might be listening and thinking, well, that's great, but I haven't got a pool anywhere near me that's heated to 32 degrees. How do I get that same effect? What should I do? What would you?
I mean, you've got a couple of options, really. You can either try and research, phone your local NHS hospital, ask where they know of the nearest hydro pool, the ATACP website, and links to Swim England and another site. They will help try and guide you where the nearest hydrotherapy pool if you need a warm water pool. You can. certainly if you're in a higher level sporting environment, you can equally train well in swimming pools. It just means that you're going to need to do more cardiovascular work to keep warmer, because that's what happens is basically as you swim or run or jog or jump, you will generate your own heat to help keep that widening of the blood vessels. You certainly wouldn't want to do high intense swim training in 34, 35 degrees, because you couldn't actually get rid of the heat that you're generating through exercise.
Yeah.
So, yeah.
Brilliant. So those principles can be adapted, I suppose, again, thinking about maybe we have a lot of sports and exercise doctors that listen to this podcast, and hopefully we've piqued a few of their interest to say, okay, I can see why I might be encouraging people to get in the pool. Again, I suppose thinking about resources or just general advice for anybody wanting to start doing exercise in water. We'd say if you need rehab from an injury, go and find a aquatic therapy trained physiotherapist. But for those people that, maybe just have been inspired to want to get into the water, what would you say?
In terms of what equipment or what to do, or
just the kind of starting tips? Is there any resources? Are there kind of things that you would say, rather than just getting in a pool and swimming, which, for some people, they don't love.
Getting in the pool, the thing is that you can do your functional activities quite well anyway. So if you're getting in, if you're not a swimmer, and you don't have to be, you can literally get in a pool and walk up and down, jog, move any movement in the water. The nice thing about that drag resistance, it's in all directions. So it doesn't matter where you move, you're going to be working against the resistance. So you can do plenty of things in vertical position without having to need to swim, which sit to stand, single leg balance, walk, all those functioning activities. If you've got a bit of equipment as simple as a rubber ring and a fin or a bat or something like that, amazing. You could even start adding a bit more resistance to work with or to help you stretch a bit more. And that's then probably where you need a guidance from someone who's had some aquatic physiotherapy training to give you ideas of how you can utilize those properties even further for your specific condition.
Fantastic, thank you. Are there any key messages or takeaways that you really wanted to get out in this? Because we haven't covered.
It kind of, well, I think there's definitely key messages in terms of if you're listening and you're a physiotherapist, try not to just take your land exercises in. They don't always work because buoyancy acts in the complete opposite direction to gravity. And there is so much more than you possibly think, because I'm saddened that our undergraduate training is so much littler than what it used to be. I don't want to say it in my day. There you go, I've said it. I now sound old. Thanks for that. But there is great research out there coming up, and arguments that will dispel what some of our sportmates doctors feel about open closed chain activity. If that's still, I know that's sort of a now maybe going out with the decade, but in the day it was definitely no open chain activity. But your drag resistance is like an isokinetic machine. It's even in all directions. So actually all the research shows that if you ask someone to kick in the water, especially if you load it a little bit further with a fin, you'll get greater hamstring activity at the terminal, the extension not quite. So it's really safe for that kind of research. And then don't be afraid of putting people in really early. This whole issue with wound infection and whatnot, I have to point out that a hydrotherapy pool is a pool of disinfectant. It really couldn't be any safer in terms of infection control. Yes, it then depends on the standard of cleaning and changing areas. But in a hospital setting, that should be clinically clean. And ideally, leisure centres are meant to keep up their standards. So if someone is day one post-op and their blood pressure's not in their socks sort of thing, then there's no issue. We can cover a wound, but I hasten to say that I'm covering a wound to stop bits of wound floating around in my pool versus worried about an infection from the water. The water is chemically tested every 2 to 3 hours, and it's microbiology tested on a weekly basis. So there is absolutely none from that. Yes, if you have to keep a wound completely dry because a cover might make it sweat, but people that worry about getting in pools from infection really shouldn't do. people that worry about, yes, got to wait for the swelling to go down, got to wait for that. Why? Because you want to get in to get rid of that, help manage that swelling in a much less painful environment. Yeah. And then the argument about, well, you can't work as hard in water as you can on land. I'm telling you all the things I've heard that I kind of could try and dispel. And please interrupt me, Claire, because I can go off on this quite a lot. But you said, we talked about the conditioning. There is absolutely evidence out there to show you can work someone as hard. But people go, well, I'm not going to an aqua aerobics class, especially if you're male and younger. I usually find that very rare to find any young males in an aqua aerobics class. But it's because they're self-selecting too slow a speed. If you go in there and speed it up, you'll be working really hard. There's a great, slightly daft, but great research out there that an old one compared a given running speed on land and in water. And because of that drag resistance, I'm really not surprised that the VO2 consumption was 3 times higher in the water than it was on land. But yes, so this image, all we do, and when I work with some of the sports guys, we change the names. We're certainly not going to call it a aqua aerobic spotty dog anymore, which is doing it. It's a split jump.
Yeah.
Yeah. But, and rest assured, I might have mentioned that strengthening up to a grade 5 can be difficult in the water from a maximum 1 rep point of view. But endurance-wise, I can fatigue someone very quickly, very easy. And then the research out there for plyometric training is huge. There's loads. And all the research shows you can get the same outcomes, but training in the water in an offloaded environment because you're working on that amortization phase. So therefore, you get it with less muscle soreness. So I'm actually impressed, Claire. If you're getting people with some muscle soreness afterwards, it tells me that you're working them really hard because it's harder to get muscle soreness in wet water.
Yeah. Yeah. And I'm so glad you mentioned the plyometrics because I think that it's so, again, freeing for somebody who hasn't been able to run, hop, skip, jump for months sometimes to be able to do that so much earlier in the pool than they can on land because of the ground reaction forces are so reduced. And again, that buoyancy just supports them, slows everything down, but they can still get that lovely feeling of jumping and feeling weightless again.
Well, yeah, because actually the drag then makes it the greater forces on the concentric component, not the eccentric, but which is great. And that, nice study that showed that they've got someone in literally half, it's like a microfracturing. Again, that's not something that I hear a lot of anymore, but, they're taking people in that have had actual bone intervention as well. And instead of being at like 8 to 24 weeks, it's around 8 weeks. So it's a significantly earlier time.
Yeah. We could talk forever, Sarah, and because there's so much richness there that we can deep dive into. No pun intended, because we're not going deep dives in our hydro pools because they're generally a lot shallower. But thank you so much. I hope everybody listening becomes as passionate about exercising in water as we are. Any resources that you've mentioned, we will add to the links on the podcast page. Wherever you get your podcast from, you'll find the links to NHS England, Swim England. There is a lovely NHS England resource for anybody who's wanting to know more about encouraging people to exercise in water. That was published earlier. It was late last year, wasn't it? We got that out with NHS England and the ATACP and Swim England. Have I missed anybody else that contributed to that document?
Mm-hmm. Not off the top of my head.
I think that was everyone.
Apologies if we have.
Yes. So please, if you work in the UK, you can access that for free as a healthcare professional. If you're outside of the UK, there's a small fee. So we'll add links to that and also to the hydro pool finder that Sarah mentioned and ATACP website. Thank you so much for joining us.
Waffling on. Putting up with me.
Not at all. It's been a good revision for me, if nothing else, and I'm sure there's a lot of people that will find a lot of useful information from that. So thank you so much, Sarah.
Thanks. Thank you for having me.
You're very welcome. Have a lovely rest of your day.